Cruise Lines International Association, which, if you like, is the governing body, has already laid out some guidelines for all cruise ships, regardless of which company we're talking about. And that involves screening people before they get on board, and then how to manage people in the event they are suspected of having the disease, utilizing the onboard medical staff. Clearly, cruise ships are familiar with viral infections. Of course, the norovirus, which is the most common gastrointestinal virus that we see on cruise ships, will spread like wildfire and has on many occasions. And so consequently, cruise ships have become accustomed to dealing with outbreaks. But nevertheless, as I mentioned a few moments ago, because of the confined spaces, it's difficult, even with trained crew, both healthcare providers and otherwise on board, to limit the spread because of the fact that everybody's in such close proximity with each other.
What do you make of the response so far, and what's likely happening behind the scenes with both the patients and passengers? It sounds like a lot of people are stuck in their rooms in quarantine.
Well, I think we have to remember this is a very fluid process. I'm learning new things as a provider who's right in the middle of this every day. I still don't know everything about this particular coronavirus. I'm not clear as a person who's intimately involved in all of this as to whether or not it truly can be spread from an asymptomatic patient to another individual. And nor are the experts from both the CDC and the WHO. Clearly, there have been some suggestions that it can be spread from an asymptomatic patient, but that hasn't been verified, because the exact answer to that question will dictate quarantine practices and when that lever is pulled to implement or execute quarantine.
Now, we've seen and witnessed many airlines around the world cutting back routes, hotels in China doing screenings of tourists. Do you think we could see more travel bans or restrictions or even closed borders? What works here and what doesn't?
I think you're exactly right. I'm not clairvoyant, but what I can tell you is that what we were seeing 2 weeks ago has escalated to a point where now multiple countries are making guidelines with regards to people coming in, crossing their borders, whether they be Chinese nationals or even their own citizens, in the event that they've been in the epicenter in Hubei province, Wuhan city, within the last fortnight. Even here in America, there are guidelines that we are implementing at our borders. So you're going to see more and more of this globally, in a global concerted effort to limit the spread of this coronavirus. And I applaud all of the countries that have stepped up. Obviously, some of them don't have as robust a healthcare infrastructure as we have here in America, for which we're very grateful. But nonetheless, everybody is doing their part to limit the spread, which is obviously complicated by the globalization of our society. Everybody is so mobile.